Hip injuries are common in the military, and many veterans file disability claims for hip conditions caused by military service. But could a military veteran file a VA disability claim for a hip condition as secondary to a back or knee condition? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service, so you can get the compensation you deserve. This video is the latest in a series of videos that I've been making in which I answer service connection questions that I get from military veterans across the country. And this one is, as I said, is fairly straightforward. It's not hip condition, hip injury caused by military service and physically demanding military duties and activities. This one is secondary to back and knee. Basically the question, I have hip arthritis that I believe is secondary to my lower back and my left knee arthritis. Can I file a disability claim for my hip as a secondary condition? It's absolutely a reasonable claim, and I'll tell you why. But let me start. Again, you may know this, you may not, but when you argue a VA disability claim for a hip injury, whether it's secondary to a degenerative lumbar spine or secondary to a knee condition like arthritis, you have to demonstrate that the hip issue was caused by or aggravated by that service-connected primary condition. But the VA regulations do allow secondary service connection and getting compensation for it for conditions that were what they say proximally due to or worsened by an existing service-connected disability. The key is establishing a very clear medical link, and you do that by arguing altered biomechanics like an altered gait, which can come from knee instability. It can be spinal misalignment, which would put more stress on the hip joint, all of which lead to more pain, arthritis, bursitis, limited mobility in that hip. First of all, make sure that the primary condition is service-connected. Whether that's the back or the knee, ideally, you want that service-connected first. There are some people that say you could file them at the same time. I've read so many denial letters doing this where somebody files a condition arguing it's secondary to some other condition, but if that first one's not already service-connected, it always gets denied. So that would be where I start getting that first condition service-connected. Then you would argue for the hip as secondary to that. You're going to want evidence basically showing a current diagnosis of that hip condition in your medical records. Ideally, it's x-rays or an MRI showing the diagnosis. You want medical records of treatments about that thing, talking about symptoms like stiffness, pain, difficult motion, functional loss, things like that. Next thing is probably the most critical. You need a Nexus letter by a qualified expert, somebody with experience in that field, in this case, orthopedics, that basically is going to argue on your behalf using phrases like at least as likely as not, or more likely than not that the hip condition was caused by or is aggravated by the lumbar spine or the knee injury. It needs to talk about your medical history or basically offer research, studies on whether it's gait alterations causing hip arthritis or any number of medical arguments. And there's thousands of studies out there, millions of studies, but specifically there's many studies for the lumbar spine affecting the hip, for the knee affecting the hip, and those would be some of the ones you'd want argued in that Nexus letter. Maybe even citing prior boards of veteran appeals decisions that basically granted service connection for similar claims. Buddy statements, or even a lay statement you write yourself describing how that primary back or knee condition affected your daily life, caused limping, that caused your hip pain, something like that. Even sometimes a DBQ written or performed by the expert that's writing your Nexus letter documenting your antalgic gait or limp can really help your claim. The ratings for hip conditions can be anywhere from 10% all the way up to 90%. It depends on the diagnosis and the diagnostic code, like 5003 for degenerative arthritis. It can be alteration of motion. It can be ankylosis, which isn't terribly common, but the ratings can be in a wide variety depending on how severe your condition is. Can even be painful motion alone that can get you at least 10%, even if that motion is not restricted. If it's bilateral, that can be beneficial as well. Okay, if you're interested in learning more about the disability claims process, I've written an ebook. You can get it absolutely free. The 8 most common reasons the VA denies service connection for disability claims and how you can beat those. Just click the link in the description under this video. Also, make sure to subscribe to this channel. Click the bell to be notified when I release a new video. and when I do my Veteran Nexus Letter live shows. Definitely check those out. Those are a lot of fun, and I answer your questions in real time. If you're interested in a Nexus letter for your injury or condition, click the link in the description below this video. Scroll down past the ebook. You can learn more about working with me and working with my team. We do everything we can to make the process as simple and as quick as we can, and I try really hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to helping you much, much more.